It's a nitrate. And what is that used for? Angina. And this is going to be, is it acute or chronic? Acute. So just think, when someone has acute angina, it's like a really fast onset, right? It's not like they have angina over a long period of time. It's like an acute problem that comes up fast, so you would want to use nitroglycerin. Okay, what do ACE inhibitors end in? Pro. So what do you use ACE inhibitors for? Hypertension. What'd you say? First line for people with diabetes, right? What else? Heart failure, congestive heart failure. So what's another drug that's commonly used for heart failure? Digoxin, right? Digoxin. But really the ACE inhibitor is going to be the drug of choice, even though digoxin is often talked about. So what is the cardiac dose of epi? 0.04. So when we have heart failure, we can have left side and right side. Which one starts first typically? The left. And what symptoms will the patient have when they have left side heart failure? Dyspnea, right? They have a hard time breathing. So this is where they have pulmonary issues, right? So they have pulmonary edema, which means in their lung. If they have right side failure, what goes on? They have systemic congestion, right? Remember, you get pitting in your legs. So left side is when you have pulmonary edema. So if you have congestive heart failure and you have a lot of extra fluid, what drug would be effective for that? A diuretic, right? Anytime they're talking about fluid retention, that's going to be a trigger for you to know that the patient needs a diuretic. Okay. So what are some adverse side effects of digoxin? Like if someone had an overdose of digoxin. Increased gag reflex and increased salivation, right? Remember, you can have that halo effect, that yellow-green vision or halo around it can cause dysrhythmias or arrhythmias, which are basically the same thing. Those terms can be used interchangeably. What does dysrhythmia or arrhythmia mean? Like your natural heart rhythm is off, right? Your natural heart rhythm is off. Okay. So how does digoxin work? What does it do? Increase the force and the rate of contraction, right? Why are you trying to increase the force? What happens when you have heart failure? What backs up? It's not pumping the blood out, right? So what it's trying to do is to increase that force in the rate of contraction to get that blood out of the heart. So if it's not pumping out, what happens to the ventricle? It enlarges, right? It enlarges and it becomes weak. It can't handle the pressure of the blood. Okay. All right. What is the most common type of arrhythmia? AFib, right? That's atrial fibrillation or AFib. So remember with arrhythmias, you have those 4 classes of drugs. What are the 4 classes? Sodium channel blocker, potassium channel blockers, beta blockers, and calcium channel blockers, right? So what's an example of a sodium channel blocker that we use every day? Lidocaine, right? That's for arrhythmias, lidocaine. Okay. What do calcium channel blockers end in? Cane, right? What are two that don't follow that rule? Verapamil and diltiazem. Verapamil and diltiazem. Okay. All right. So what antiarrhythmic drug is associated with gingival hyperplasia? Nifedipine and phenytoin is an antiarrhythmic drug. Okay. So what is angina pectoris? The heart's not getting enough oxygen, right? How is that different than a myocardial infarction? You get none, right? What's the difference between stable and unstable angina?
Stable stops at rest.
Yes. So when you have angina, you typically have pain or discomfort in your chest and can go down your arm. But if you sit down and rest and don't do anything, then the pain goes away. If you have unstable angina, doesn't matter if they're resting, they're still having the symptoms. Still having the symptoms. Okay. What type of drugs do you want to stay away from if the patient is on nitroglycerin? What category of drugs? Or I told you As Good as It Gets, that movie. Erectile dysfunction drugs. Because it causes, what does it cause? Hypotension, like severe hypotension. Okay. What category of drugs decrease the effectiveness of most antihypertensive drugs? NSAIDs. NSAIDs will decrease the effectiveness of most antihypertensive drugs. So what is hypertension? How would you describe that? Increase of what type of pressure? Arterial pressure. And too much or increase of arterial pressure, right? You need to know the blood pressure classifications because you're going to have examples on that. Okay. So what does statin drugs do? They reduce the what? So we have two types, right? LDLs, right? We have LDLs and HDLs. The LDLs are bad, the HDLs are healthy. So overall, what should our cholesterol be? Under 200. What do we want our LDLs to be under? 130. We want our HDLs to be greater than 35. We want it to be greater than 35. Okay, what is essential hypertension? It's idiopathic, right? It could be idiopathic or primary hypertension. This is just when you have pre-hypertension in your stages. Like nothing else is causing it. There's not another disease that's causing hypertension. It's just everyday hypertension. What is secondary hypertension? Associated with endocrine or renal disease, and then some medications can lead to hypertension. What are some examples we just talked about? Steroids, birth control. Those are probably two big ones. And malignant hypertension is what? Retinal and renal damage, right? So just think malignant is bad, then damage has already occurred. Malignant is bad. Evidence of retinal or renal damage. What are some risk factors for hypertension? Stress, obesity, what type of personality? Type A. Did genetics play a role in it? Yes. So family history, sedentary lifestyle, right? You're not getting up and exercising. Sodium intake. Why is sodium intake the risk factor? Because when you have high sodium, right, water comes along with it, and that increases the fluid retention and increases the hypertension. Okay. Okay, what are the types of diuretics do we talk about? Loop, diazides, potassium sparing, right? So you need to know examples of it. What is an example of a thiazide? Hydrochlorothiazide. And this is probably going to be, so if someone has just stage 1 or if they're pre-hypertension and the doctor says, I need to start you on a medication, what are they going to most likely start with? Yes, it's some sort of diuretic, right? Thiazide is one of the most common. What's the strongest diuretic? Loop. What's an example of a loop diuretic? Furosemide or Lasix, right? So we know with thiazides and loop diuretics, what do we typically lose that sometimes we might need to replace? Potassium, right? It causes hypokalemia, that's a low amount of potassium. So you might need additional potassium if you're on one of those. Aldactone, diuretic, those are potassium sparing diuretics. They're also known as puny diuretics. Don't need additional potassium because you're not losing the potassium, right? That can actually damage your kidneys if you have too much. Okay.
Oh, wait, what? I'm on one. I'm scared.
What?
I don't know, I read it. It's all around my kidneys.
No, it's not. You're on a potassium sparing, right?
Yes.
Yeah, you don't need extra potassium.
Okay.
Just don't get extra potassium, alright?
Okay.
So potassium can actually, if your potassium's off, it actually can increase your risk for arrhythmias, and then when you add epi on top of that, that risk goes up even more. Okay. So one thing a thiazide can do, why do you want to avoid a thiazide with a diabetic patient? Increases the glucose, right? So that is going to be increased risk of increasing the blood glucose level. So you have to stay away from that with a diabetic, which is why a lot of the times they give them a what? ACE inhibitor. ACE inhibitor. Okay, so we talked about the NSAIDs affecting most antihypertensive drugs, but what is one that it doesn't impact for sure? Calcium channel blockers. It doesn't impact calcium channel blockers. And calcium channel blockers are not going to affect asthmatic patients. What drugs can affect asthmatic patients? Non-selective beta blockers, right? Non-selective beta blockers. And if you have a non-selective beta blockers, what do you have to do with the epi?
Cardiac.
Decrease it, right? You have to decrease it to, what is it? 0.04. Okay. What is another common adverse effect of ACE inhibitors? Dry cough. Dry cough. So dry cough goes with ACE inhibitors. So a lot of these are gonna cause antihypertensive drugs, especially if you have a diuretic, it's gonna cause xerostomia, right? And oftentimes, you're gonna have altered taste when you have xerostomia. Okay, so ACE inhibitors and then krill. ARBs in sartan, right? ARBs in sartan. So when would someone take an ARB? Yes, when they are unable to take an ACE inhibitor. Okay. Let's see. What are two examples of selective beta blockers? Metoprolol and atenolol, right? Metoprolol and atenolol. And then non-selective, propanolol, atenolol. So atenolol is usually for your eye. So propanolol or indirol is usually for blood pressure. Okay. Okay, so statins, we talked about statins reduce what? LDLs. They reduce LDLs. What are some drugs that are used if someone's had a heart attack or a stroke? Anticoagulants, right? What are some examples? Warfarin, which is Coumadin. Heparin. When would heparin be given? In the hospital, right? Through an IV. What about a daily dose of aspirin? How much would they take? 81. What is Eliquis used for? To prevent a stroke, right? Or some sort of embolism. Stroke or embolism. Alright. Okay. Let's go on to GI disorders. Okay, so what is the most common GI condition? GERD, right? What causes GERD? Yes, the sphincter does not stay closed, right? So what comes back up? The pepsin and the stomach acid, right? And that can lead to what in the mouth? Erosion, right? So what condition can increase the risk of having esophageal cancer? There, it's esophagus, right? So this is when that's going to be associated with GERD. Causes irritation within that lining. Okay. What are some common drugs that are used for GERD? Proton pump inhibitors, right? Those NN, Zol, and those work on what? The acid pump, right? We decrease the amount of acid. What other type of drugs? Reglan, yes. That's a prokinetic drug that increases gastric emptying. What did you say? Histamine 2 receptor blockers, right? What are those in? Tidine, right? Cimetidine is an example. So those are Tidine. If someone just had occasional heartburn, what would they need to take? An antacid, right? Occasional heartburn, they're not going to be on something every day. It's an antacid, like Tums or something like that. What are antiemetics used for? To prevent from throwing up, right? So what we said, what causes most ulcers? H. pylori, right? 90% of the gastric and then the small intestine. But when someone has an ulcer, what type of drugs do they need to take? If it's caused by H. pylori. Antibiotic, right? But you also have to take another type of medication that's gonna decrease acid, right? Because the H. pylori will start the inflammatory process, right? But if you had acid and you're pouring acid, say if you had an ulcer in your mouth and you pour acid on it, what happens? It hurts, it makes it worse, right? So they might take additional proton pump inhibitor or an H2 receptor blocker on top of the antibiotics. Okay, what are some symptoms of an ulcer? Belching, bloating, heartburn, and epigastric pain. Remember, that's that pain when you get pain underneath your ribs. Okay, smoking and caffeine do what to gastric acid secretion? They increase it, right? So if you have an ulcer, you're at risk, you want to stay away from caffeine and stop smoking, right? What does alcohol do to our stomach and our lining? It irritates it, right? It makes it inflamed, it's raw. So if you have an ulcer and you pour alcohol on it, it's not gonna be good. Okay, NSAIDs, aspirin, and corticosteroids, they increase the risk of having ulcers, right? So when we talked about they work by decreasing prostaglandins, but what do we know prostaglandins do to our GI tract? They protect it, right? It protects it. So if it's not, if we don't have the prostaglandin to protect that lining, then you increase the risk of having an ulcer. Okay, what antibiotics are used when you have an ulcer due to H. pylori? Metronidazole, amoxicillin, tetracycline, and clarithromycin. Right. So you have to have at least how many of those? Two. You don't just take one antibiotic, you have to take a combination. Okay. What the histamine 2 blocking agents, what can that cause us to be? It's an antihistamine, so drowsy, right? Sedated. Also can cause GI issues, constipation. Okay, so proton pump inhibitors, what are they in? Zol. What are some side effects in the mouth or around the oral cavity that can cause? Esophageal candidiasis, xerostomia, and atrophic glossitis, right? That's when you have atrophy of the papilla. So what does the tongue look like? Smooth and red, right? It's smooth and has a glossy appearance. Okay. What is an example of a systemic antacid? You have to, people that have cardiovascular diseases have to stay away from it. Systemic antacid. You might rinse with this if you throw up a lot. Sodium bicarbonate, right? Sodium bicarbonate is a systemic antacid. Why do cardiovascular patients have to stay away from that? Because sodium will lead to hypertension, right? Hypertension. Does that make sense? Okay. So if someone has IBS, what issues might they experience? Constipation, diarrhea, or spasms, right? Spasms. So it goes different ways. So if they're having constipation, then what type of medication would they need? Imodium, right? Some sort of, a laxative, sorry. If they're having too much, if they're having diarrhea, then you give them Imodium, right? Something to slow it down. If they're having spasms, what are some examples? dicyclamine, hycosamine, and dicyclamine. Those are gonna be the two most common ones. So dicyclamine, I would remember that. Okay, what are some drugs that we give for nausea? Promethazine, which is phenigrin, right? Zofran is another one. What are some drugs that are used for motion sickness? Scopolamine or scopolamine, that's a patch. Dramamine and what's the other one? Meclizine. What type of antipsychotics will help, it is used as an antiemetic? Compazine, it's a first generation antipsychotic. Remember, so first generation antipsychotics are used as an antiemetic. Okay. Okay. We go see if there's someone on it that's coming up, if there's someone on the schedule for 12 on our ring. Okay. Okay, so what is epilepsy? Yes, when you have seizures repeatedly. So when you have a seizure, what's happening? You have abnormal electrical activity of your brain, right? So what do we want to do to help control this electrical activity? Depress the CNS, right? We're depressing the CNS by enhancing what? GABA, or blocking what channel? Sodium channel, right? Blocking the sodium ion channel. So, do you always have convulsions with seizures? No. But if you had a loss of consciousness and they were doing some jerking and all this, how would you define that? Would that be a generalized? Generalized, right? Generalized convulsive seizure. They're jerking and stuff like that. What's the difference between a partial and a generalized seizure? Partial is on one hemisphere of your brain, generalized is on both, right? Generalized is on both. Sometimes that's called a focal seizure, partial or focal. So how long, if someone was having a tonic-clonic seizure, how long should that last? Yeah, typically it's gonna last 1 to 3 minutes, but if it lasts 5 minutes or more, it becomes what? Status epilepticus, and what do you need to do? Call EMS, and what drug would you give them? A benzo through an IV, right? A benzo through an IV. Lorazepam, diazepam would be 2 examples. What kind of seizure is it when someone just kind of blanks off and stares off into space for like 10 seconds? An absence or absent seizure. What is the drug of choice for them? Serotonin or ethosuximide is the generic. Valproic acid can be used, but serotonin is the drug of choice. So a simple, what's the difference between a simple and a complex absence or absent seizure? Complex, you use something else, right? They're like blinking or chewing or doing something, and it lasts up to 20 seconds. It lasts a little bit longer. With the partial seizures, those can be simple and complex. How would you differentiate between those? You don't lose consciousness with what? The simple, right? If it's complex, you can lose consciousness. It's also called a psychomotor or temporal lobe seizure. So in that temporal area, that's where we get our alertness and we're aware of things. So when that's impacted, we lose consciousness. And sometimes with seizures, you might have an aura. What is that? Some sort of sensation or something happens right before someone has a seizure. So it could be flashing lights, or they could smell something, or do something like that. Okay. So, what are some older anticonvulsant drugs? Yes, phenobarbital, which is a long-acting barbiturate, right? What do we know that can cause? Respiratory depression, right? It can cause a lot of drowsiness. What's another older anticonvulsant drug? It's not used that often anymore. Phenytoin or Dilantin, right? What do we know about phenytoin? Yes, it can cause genital hyperplasia, floppy infant syndrome, right? You can have that fetal high syndrome. So you have cranial facial issues. You can have floppy infant syndrome. So there's a lot of different things. So you don't want to take phenytoin or phenobarbital when you're pregnant, right? What are a couple other drugs that you don't want to take? Yes, valproic acid, sorry, and then carbamazepine. You want to stay away from that. So valproic acid, what do we know about valproic acid? It's used to treat all types of generalized seizures, right? What are some oral side effects that can occur? Bleeding and xerostomia. So you need to know it treats all types of generalized seizures and can cause xerostomia and bleeding. Also can, cause issues with fetus, so you don't want to take that. Okay. What anticonvulsant is often used for trigeminal neuralgia? Carbamazepine or Tegrenol. What else can that be used to treat? Fibromyalgia. Bipolar. Remember, a lot of them can be used to treat bipolar. Okay. Let's see. Okay, Lamictal. And Lamictal is a second generation anticonvulsant, right? So what is it used to treat? Seizures, but also what? It can be anxiety when they have depression, and then bipolar, right? Bipolar disorder. Okay, so Lyrica can be used to treat what? What are some other things besides seizures? Anxiety, so an anxiety disorder, or neuropathic pain. Neuropathic pain. What is another drug that can be used to treat neuropathic pain? Gabapentin or Neurontin, right? Neurontin, think neuropathic, right? So that could be diabetic peripheral neuropathy or postherpetic neuralgia. Okay, so if someone's having a seizure, how would you want to place them? On the ground with their head to the side, right? So they don't aspirate. Okay. Do y'all want to keep going or like forget about lunch? Okay, let's go on to the CNS disorders. So back to the anticonvulsant. So how would you describe the therapeutic index of most anticonvulsants? Narrow, right? Narrow. So that means you have to carefully monitor them. They're narrow. Okay, what's the most common form of psychosis? Schizophrenia, right? And oftentimes you'll take a antipsychotic drug, right? So when someone has schizophrenia, they have positive symptoms and negative symptoms. What are some positive symptoms? Hallucinations, delusions, thoughts. Whereas negative is lack of emotion, right? Lack affect. They're withdrawn. They're basically don't want to do anything. Like just say negative, nothing. Right? There's nothing there. So positive, something is happening. So first generation agents help with what? What type of symptoms? Primarily positive, right? Primarily positive. And they are primarily what type of antagonist? Dopamine. So first generation are primarily dopamine antagonists, where second generation are dopamine and serotonin. Okay, so besides the dopamine receptors, antipsychotics or first generation agents can bind to what different receptors? Muscarinic, right? And what can that lead to? Muscarinic goes with what type of system? Cholinergic, right? Cholinergic. So if they're blocking the muscarinic receptors, what can that lead to? What's the opposite of cholinergic? Xerostomia, right? Urinary retention, all of that. Okay, so one muscarinic, what's another one? What alpha receptors? Alpha 1, right? Alpha 1, what are alpha 1, what's that gonna lead to? Or it can lead to orthostatic hypotension, right? You're blocking alpha 1. We know alpha 1 usually causes vasoconstriction, but you're blocking it. Okay, so muscarinic, alpha 1, and histamine, right? So when they bind to histamine, what can that cause? Drowsiness, right? Okay. All right. So what is acute akathisia? When you like move, like you sway, you move from foot to foot, you can't sit still. Remember, the first generation antipsychotics, you're going to have more risk of having those extra pyramidal effects. So that's dystonia or Parkinson symptoms like tremors or impaired gait. Akathisia, what is tardive dyskinesia? The involuntary tongue, yes. Okay. All right. I would know examples of both of those. Okay, so what can be used to treat depression? What's most often? Antidepressants, right? Sometimes some second generation antipsychotics, but oftentimes it's going to be an antidepressant. What are some common antidepressants? What's probably the most common group that's prescribed? SSRIs. They're the most common, right? SSRIs. What's the first SSRI? Prozac, right? What are some other examples of SSRIs? Zoloft, Paxil. You're right. Okay, so SSRIs block the reuptake of what? Serotonin, right? Serotonin. The more serotonin we have, the better we feel, right? SNRIs block what? The reuptake of norepinephrine and serotonin. What are some examples? Cymbalta affects your prestige. Cymbalta is often used to treat what? Fibromyalgia. Fibromyalgia. Okay, let's go back to SSRIs. What are some adverse effects of SSRIs? What does it do to our CNS? It stimulates it. It stimulates it. So a lot of drugs that we talked about depresses it, but it stimulates it. What does it do to our mouth? Xerostomia, right? Xerostomia. So it can cause some nervousness, some bruxism. What are some GI issues that can happen? Nausea, vomiting. Yes, GI bleeding. Yes. Okay. All right. Let's go to tricyclic antidepressants. So when are tricyclic antidepressants given? Moderate to severe depression. So they're not like a first thing that people usually give, for depression. They'll start off with SSRI. But it can help with a lot of other conditions. What are some other conditions? OCD. What is it? Bipolar. Other conditions like migraines or facial pain, right? So a lot of other things other than mental things. So tricyclic antidepressants will help with that. What do they block the reuptake of? Norepinephrine and serotonin. What do we know about tricyclic antidepressants and epi? You have to limit it to the cardiac dose, right? 0.04 epi. 0.04 epi. Okay. MAOIs, what do you know about them? So monoamine oxidase, that will break down catecholamines, right? Monoamine oxidase breaks down catecholamines, like epi or norepinephrine. So if that inhibits that, that means you're gonna have more of serotonin and all that. So that's how it helps with depression. But why isn't it used really much? A lot of drug and food interactions. What food interactions? Wine, aged cheese, and sausage. Yes. Okay, so if you use a tricyclic antidepressant and an MAOI, you're at risk for what type of syndrome? Serotonin syndrome, right? Serotonin syndrome, you have too much of that. Also, if you use an antidepressant with a migraine medication or an opioid, it can lead to serotonin syndrome. So serotonin syndrome means that you have too much serotonin. Too much serotonin, right? So that can make someone have insomnia, they can be agitated, they can have seizures, they can even die, right? Can be pretty severe. Okay, bupropion is also known as Wellbutrin. What does it block the reuptake of? Dopamine and norepinephrine. Dopamine and norepinephrine. What do we use bupropion for? Depression, right? Seasonal affective disorder, which is what? Yes, when you have depression, when it changes in season, like this is a good time right now since we don't have much sunlight going on. What else? Smoking, so smoking cessation, right? Smoking cessation. So seizures, bupropion is like it's 0.4% or 0.4, yeah, no, 0.4, I was right, percent incidence of you to have a seizure, which is more than a tricyclic antidepressant. And you wouldn't think 0.4 was that high, but they're linked with seizures. Just like other antidepressants, bupropion will cause urostomia. It is one that is linked with weight loss. They say SSRIs are weight loss too, but I don't agree with it. Because they actually use it for eating disorders like bulimia or anorexia. Anyway. Okay, trazodone. What do you know about trazodone? What type of antidepressant is this? Serotonin modulator. Serotonin modulator. It's a first generation. In addition to depression, what can you use trazodone for? Insomnia, right? It makes you sedated, it makes you tired, insomnia. Okay, what do we know about lithium? It's a gold standard for mood stabilizer. What about the therapeutic index? It's narrow. It's narrow. What are some adverse side effects of it? Thirst, right? Increased thirst. Polydipsia, that's increased thirst. Xerostomia is one. Tardive dyskinesia, which is the tongue movement. So all these things can impact your treatment. All these things can impact your treatment. Sometimes they'll have a metallic taste, and oftentimes they'll have hypothyroidism. So if they have hypothyroidism, what do you think is going to happen to their weight? Hypothyroidism means your thyroid gland is not working. You gain weight, right? So your thyroid helps us with our metabolism, right? Our metabolic rate. Okay. What drugs will increase the lithium concentration? NSAIDs. So would you want to use NSAIDs with lithium? No. What else? Sartans, thiazide diuretics, and metronidazole. Metronidazole. Okay. All right. Okay. I think that's it. We kind of talked about, we did adrenocorticosteroids today, so I think y'all should get this. Any questions?